I'm Dr. Sudhir Mane. I'm a FNB fellow at Anup Institute. Uh, so my topic for today is importance of rehab and patient education to maximize recovery. So basically, we all know that joint replacement surgery is a life-changing intervention for many people. And we are now in the era of robotics, augmented reality, and AI. But despite the advances in surgery and you know, innovations in surgical techniques, recovery is still dependent on post-op care. That is something which robots cannot do for you. Of course, you can take the aid, you can take the help of technology, but that is something which cannot be automated or left to AI or something. So, so I will be discussing these factors in my presentation. So effective rehab and comprehensive patient care, patient education is vital for maximizing recovery. So the journey, so we have a quote, it's not about the destination, it's about the journey. So I would like to bring this analogy to joint replacement surgery as well. So it's not just the surgery and when the patient starts ambulating and gets back to their daily life. It is a constant phase, right from the preoperative phase when they are diagnosed, when they are assessed, whether they are fit for or I wouldn't say fit, but do they meet the criteria for that particular surgery? What is the best possible plan available for them? And then the post-op phase, and then the long-term outcomes. So it's a long journey, and this is where we as clinicians, our therapists, and the patient's family come into the picture. It's a teamwork basically. So the objectives of rehab are pain management, restoring mobility and strength, and preventing complications. So the components of an effective rehab strategy, these include physical therapy, occupational therapy, lifestyle modification, and nutritional support. So I'd like to stress on lifestyle modification and nutritional support in the context of joint replacement surgery. Especially before surgery, if patients are, if they have any habits like smoking, drinking, or if they are obese and they have high blood sugar, we often advise patients to modify these factors so that the outcomes are better, because after surgery, a lot of times the risk of DVT or other surgery related complications are high. So this definitely plays an important role. And nutritional support after surgery, we are all aware that good supplements, protein intake, good nutritious diet is definitely important. But even in the perioperative phase, good hydration and maintenance of a good fluid balance is vital to ensure good recovery. So preoperative education and its impact. So our first goal is to set realistic expectations. So a lot of times people, especially youngsters, so they have very high expectations. They think, okay, after joint replacement surgery, I'll be able to get back to sports, I'll be able to get back to contact sports, or if they have a very high or active lifestyle, I can get back to whatever I was doing before the surgery. But then setting these expectations are often hard on the patient, and many patients tend to, it's pretty much like the stages of grief that, I won't be able to do this anymore, especially if it's someone like a sports person. So we have to keep all these factors in mind and set their expectations accordingly. And if necessary, we should we should involve counselors and psychologists as well to prime the patient and their family to these outcomes. I have stressed on these in the next slides. And apart from this, preoperatively starting exercises to strengthen muscles, involving the family and preparing them for the journey after surgery is very important. So in the first 48 hours, our goals include early mobilization, managing pain, and establishing recovery milestones. So in the early post-op period, it's quite common to use epidural analgesia or fentanyl patches or local blocks like femoral nerve block to uh, minimize pain and maximize participation in physiotherapy. But again, these can be quite challenging because you need to have good, your anesthesiology department should be quite well equipped. You know, you need to have practitioners who are skilled at giving blocks. So it's not a one size fits all strategy. It has to be tailor made according to the patient. And so we have the ERAS protocol, that is the early recovery after surgery. It includes nutritional support, pain management, fluid management and hydration, and early mobilization after surgery. And we also have emphasis on preoperative education, collaboration, and improved clinical outcomes. So this is a paper that was published last year in the SICOT journal, and there's considerable interest in this. It's not just the outcomes of the robotics. It is on patient education also, where active research is going on. So this is quite obvious. So strengthening, improving ROM, balance and coordination, and patient-specific rehab protocols. So the protocol should be tailor-made according to the needs of the patient and the joint that is being operated upon. And you have to adjust accordingly based on the cardiovascular status of the patient. And addressing post-op complications, you have the first and foremost is prevention of DVT, early mobilization, and through pharmacological prophylaxis, preventing infections, and preventing joint stiffness, addressing wound complications, especially early and delayed. We have seen certain cases where in patients with filariasis who've got, the wound healing was delayed in these cases. So we empirically decided to, we consulted our physicians and we were suggested that a trial of diethyl carbamazine before surgery and in the post-op period leads to lesser wound complications in these patients. And similarly for patients with RA or other diseases, other autoimmune diseases, if they are on methotrexate or any immunosuppression drugs, it is better to hold these for a few days till the wound has healed completely. And coming to the psychological aspects of recovery, patients often tend to be anxious, and keeping them motivated throughout the journey is often a challenge. So our goal should be to empower patients so that they stay motivated despite the pain, and even the family members should be supportive enough so that the patient goes through the early rehab process. So a study was done in our institute, and we concluded that total joint replacement patients can benefit from involvement of psychologists in their care and experience better recovery and surgery outcomes. So the role of technology, we have robot-assisted physiotherapy, we have tele-rehab and mobile applications which can improve compliance. And importance of long-term patient education is crucial. So we have to, after joint replacement surgery, we have to educate the patient. So it's almost like giving them the idea that this is something valuable we have given you, and it is your duty to safeguard it. Like, treat it like gold or money that you have. So it is your wealth, it is your responsibility to safeguard it. So you have to modify your lifestyle accordingly. So this is some idea which we repeatedly stress upon in our patients, because they often come from backgrounds, they are poorly educated, they do not understand the technical terminology or the, so it is important to impress upon them that this is something this is a gift that they have been given, and it is their goal to safeguard it. And lifestyle adjustment, as already discussed, and we also give them a home exercise program. So empowerment is definitely important. So you give them personal goals, milestones in their recovery. So patients also feel satisfied that, yes, I have met this, I'm able to do this. And it is very important to ensure that patients are able to do these daily activities while they are in the hospital, like something like getting out of bed, using the toilet, climbing stairs. Few more minutes. And so The recent evidence on these interventions. So this study from 2022 highlights that pre-op education and rehab protocols are definitely important. And another study which involved 37, it was a meta-analysis of 37 studies with a total pool of 5,185 patients have similar findings. And this paper from 2021 said integrated education is more effective and decreases pain intensity and edema. So common challenges, non-compliance, lack of access. Patients often come from far-flung areas, so it becomes difficult to reach out to them. Sometimes patients come from, like we in Patna, we get a lot of patients from the northeast, so which has difficult terrain. There's political strife, there are floods, natural disasters. So after surgery, it is often difficult for them to reach out to us. So we have come up with app-based telephonic therapy so that patients feel connected and they can reach out to us at any time if they have any issues. So conclusion, multidisciplinary teamwork between surgeons, therapists, and patients leads to better long-term outcomes. Thank you.
Thank you, Dr. Sudhir, sir.